Hello friends. So in this video we will learn about Kangaroo mother care, a special way of caring low birth weight and preterm babies. It is a very unique procedure. It is implemented immediately after birth, and if the baby is found preterm baby and having low birth weight, that is less than 2.5 grams, 2.5 kg or 2500 grams, then in that case definitely the baby is going to be placed in KMC unit, and the Kangaroo mother care is going to be provided to the baby. So what is Kangaroo mother care? It is a special way of caring low birth weight babies. It fosters their health and well-being by promoting effective thermal control, breastfeeding, infection prevention, and bonding. So the things which are required for the newborn baby in the initial stage of growth and development, everything will be provided in the KMC unit itself in terms of Kangaroo mother care. And we should understand the background of this KMC, how it is um, adopted, and how we started practicing in India. So if we look into the history, Kangaroo mother care was invented in 1978 by Colombian pediatrician Dr. Edgar Ray, and because he faced a shortage of incubators to take care of this LBW and the preterm babies, and he found that mothers could use their own bodies to warm their premature infants. So that was the initial stage where he could develop or invent this Kangaroo mother care method. So to understand more about this history, it was developed as an alternative to inadequate and insufficient incubator care for those preterm newborn infants who had overcome initial problems and required only to feed and grow. Almost 2 decades of implementation and research have made it clear that KMC is more than an alternative to incubator care. So there are several research studies conducted on this problem, and finally it has been proved that this is an effective method more than this incubator care. So it has been shown to be effective for thermal control, breastfeeding, and bonding. So these three are the major advantages the child is going to get as well as the mother. In all newborn infants, irrespective of setting, weight, gestational age, and clinical conditions. So in short, let us see the history here. A team of pediatricians started KMC in Instituto Materno Infantil Hospital in Bogota, Colombia in 1978. Then Kangaroo mother care was introduced in India in 1994 at BJ Medical College Hospital, Ahmedabad, Gujarat. Then in 2003, World Health Organization formally endorsed Kangaroo mother care and published KMC practice guidelines. And this was followed by experiences in KEM Mumbai and the All India Institute of Medical Sciences, that is AIIMS hospitals. And the KMC India network consisting 6 institutions was started in 2003. So this is the brief history of Kangaroo mother care in India. And you may have a doubt why the animal is chosen or why it is termed in the name of animal. So kangaroo is an animal found in Australia. That is a common known matter, everybody knows about it, and she invariably delivers a premature baby. The premature baby kangaroo stays in the pouch of her mother, where it gets warmth and exclusive breastfeeding till it is mature enough to survive outside. So this is the lesson we learn from this animal. That's why the name is exactly fitting with this care of preterm babies and the LBW babies. That's why it is named after the animal kangaroo. Let us see the eligibility criteria for kangaroo mother care. I'll start with the baby. So care of stable preterm and LBW infants, low birth weight infants, can be administered or can be admitted for this kangaroo mother care, and that is those who can breathe air and have no major health problems, who need thermal protection, adequate feeding, frequent observation, and protection from infection. Such babies are eligible to get this KMC, particularly for caring LBW infants weighing below 2000 gram or 2 kg, less than 2 kg. And KMC should be started after the baby is hemodynamically stable. That is one of the criteria. The infants of birth weight less than 1200 gram with serious prematurity related morbidity may take days to weeks to allow initiation of KMC, because it is one of the criteria that at least the child should reach, or the newborn should reach, the weight of 1800 to 2200 grams. So then the baby is eligible to get this kangaroo mother care. So let us see the eligibility criteria for the mothers. All mothers can provide KMC irrespective of age, parity, education, culture and religion. Mothers should be free of serious illness and able to take adequate diet and supplements recommended by her doctor. So it is mandatory that the mother should be healthy and free from any serious illness. She must be willing to provide KMC to her baby. It is the self-motivation or self-interest of the mother. She should maintain good hygiene, daily bath, change of clothes, hand hygiene, short and clean fingernails. These are the things are mandatory for the mothers, and she should have supportive family and community to be encouraged to continue KMC to her baby, because it is not possible by the mother only to give this KMC. All the family members has to take part in this. So everybody can give this KMC in order to maintain the thermal level and bonding, to establish the attachment or bonding between the parents as well as with the family members. So components of KMC, the major components are three. One is skin to skin contact, because in order to maintain this thermoregulation, skin to skin contact is important. That's why immediately when the baby is born, the baby is put on the chest of the mother or the breast of the mother, so that skin to skin contact which promotes thermal control. So direct, continuous and prolonged skin to skin contact is provided between the mother and her baby to promote thermal control. And second is, because the baby is always with the mother, it is easy for the mother to feed the baby also. So it is called exclusive breastfeeding, and it is promoted by skin to skin contact, and it promotes lactation and feeding interaction with the exclusive breastfeeding for adequate nutrition and to improve desired weight gain. So altogether, these two factors, skin to skin contact and exclusive breastfeeding, promotes bonding between the mother and the baby. Right? So these three are the major components of kangaroo mother care. So what we require to provide this kangaroo mother care? So KMC does not require any more staff than conventional care. So existing staff members can give, either maybe doctors or nurses should have basic training in breastfeeding and adequate training in all aspects of KMC as described below. One is when and how to initiate the KMC method. So it is mainly based depends on the birth weight of the newborn, that they have to understand whether it is a preterm baby or low birth weight baby, and what is the birth weight criteria to fulfill this KMC procedure. How to position the baby between and during feeds. Then they should have the knowledge about feeding LW babies and the preterm infants, and they should have the knowledge about breastfeeding, and they should know how to and when to discharge the baby and mother, and the ability to encourage and support the mother and the family, because as I mentioned earlier, it is not only the responsibility of the mother, everybody in the family has to share the responsibility in carrying the baby. Time of initiation of KMC is most important. It is categorized based on the birth weight of the newborn. So it is mainly divided into three. One is if the birth weight is less than 1200 gram, or if the birth weight is 1200 gram to 1800 grams. And the third category is if the birth weight is more than 1800 gram and up to 2500 grams. So if it is less than 1200 gram, the most of the infants suffer from serious morbidities. Therefore, birth should take place in specialized centers only, and it may take days to weeks before KMC can be initiated. So these babies, until unless they reach a particular uh, expected weight, then KMC should not be initiated, because already they have some serious morbidities because of their severe low birth weight. And the second category is if the birth weight is between 1200 to 1800 grams. Here many infants suffer from serious morbidities and they should be transferred to the specialized center, and while transferring, mother or the family member should be with them, and the transport incubator is not available, it is mandatory that mother should be there with the baby, because we have to start this components of KMC like skin to skin contact and the breastfeeding should be initiated. So here exclusively KMC can be initiated. It may take days before KMC can be initiated, because the weight should be maintained for the baby, or if the baby is stable and free from any other kind of serious morbidities, it can be initiated. And the third category is if the birth weight is more than 1800 gram and up to 2500 grams. For this category neonates, and they are generally stable, so KMC can be initiated immediately after birth. So this is the classification or the time of initiation of kangaroo mother care. So let us see the position, how to place the baby to provide this KMC. So the baby should be placed between the mother's breast in an upright position. Head should be turned to one side and the slightly extended position. Why this position? Because the extended position keeps the airway open and allows eye to eye contact between the mother and the infant. So this is most important, because this eye to eye contact promotes bonding between the mother and the baby. Next is the hips should be flexed and abducted in a frog position. The arms should also be flexed. So the infant's abdomen should be at the level of the mother's epigastrium, and mother's breathing stimulates the infant, thus reducing the apnea. So everything has a rationale. So when we are placing the baby, and if we are not placing the baby properly, definitely the advantages of this procedure is not going to be achieved. Support the infant from the bottom with a sling or with the binder. And finally the position will be like this. Baby between mother's breast, and you can see the head is turned to one side. As I mentioned earlier, this will help the baby to have normal breathing and to have eye to eye contact with the mother, that promotes bonding. And you can see the right hand is supported at the bottom of the baby, and the position, it is a frog leg position. Leg is flexed and in an abducted position, right? And the baby is exactly placed in the epigastrium of the mother's abdomen. So this is about the position of baby during KMC procedure. So what about the mother? The semi-reclining position, that is 40 to 45 degrees, is to be adopted while sleeping. That mother can follow this position, and this can be achieved with the help of 3 to 4 pillows on the hospital bed, or special semi-reclining chairs also can be used. And if the mother is carrying an infant in KMC position, she can walk, stand, sit, or engage in different activities. There is no restrictions for the mother to stop from all these activities, right? So this is about the KMC position for mother. Then how we prepare the parents or the mother for the KMC procedure? You have to start with counseling. So explain the benefits of KMC to mothers and the family members, because they are unaware about this KMC procedure, and psychologically they are distressed because of the prematurity of the baby or the low birth weight of the baby, right? So demonstrate the procedure to the mother gently with patience. Answer the questions as asked by the mother and the family members. So it is only possible through counseling we can make them understand and clear the doubts related to KMC procedure. And regarding the clothing of the mother, mother should wear front open light dress as per the local culture she can wear. A suitable apparel like kangaroo baby, kangaroo bag, baby bag, chari, binder that can retain the infant for an extended period of time, and it can be adapted locally also. So this is about the mother's clothing, because it is most important. The mother is going to carry the baby for 2 hours or 3 hours or 4 hours continuously. In that case, the clothing is most important. And for the baby, it can be dressed with the front open sleeveless shirt, cap, socks, and hand gloves are important, especially to prevent heat loss. Okay, so this is the preparation uh, for the mother and for the baby, and we have to prepare the family members as well by providing counseling services. Now, how long to continue this kangaroo mother care? Okay, so if it is a short-term duration, 4 hours daily it can be given, or if it is extended duration, up to 5 to 8 hours also can be given to the baby. And in case if it is a longer period than 9 to 12 hours, or if it is continuously it is given to the baby, then more than 12 hours also. So the person can be changing in between. Mother is giving, then the father and the family members can give this or continue this KMC for the longer period of time. Okay, so the time duration is extended. The duration to be counted as cumulative completed hours during a 24-hour period. So in that 24-hour period, how many hours of KMC is given to the baby, that will be the total duration, right? So everybody should take part in the family to provide this KMC. Except feeding the baby, remaining time everybody can handle the baby, and it should not be less than 1 hour. Okay, so because frequent handling of the baby also causes some illness to the baby, so that should be avoided, and accordingly the family member should plan and KMC can be given. Let us see the benefits of kangaroo mother care. One is it helps in thermal control and metabolism. So this is a major component. For this purpose only KMC is implemented to maintain or to promote this thermal control. Secondly, results in increased duration and rate of breastfeeding. So because always the mother is carrying the baby, skin to skin contact is there, so it promotes breastfeeding whenever the child demands. On-demand feeding can be fulfilled, then the mother can also recognize or understand the need of the baby. The KMC satisfies all 5 senses of infant, because always the baby is on the chest of the mother, so the baby can have the touch, vision, and smell, taste, and uh, hearing. So she can hear the voice of the mother, she can have the touch with the mother, and she can smell the breast milk of the mother, and eye to eye contact with the mother, and she can feel the mother, right? So these all 5 senses are satisfied completely if KMC is provided. Then baby has more regular breathing and predisposition to apnea. So if the baby is placed, as I told you, the mother's chest wall movements of the respiration will initiate the baby to breathe, and it will reduce the chances of apnea. It protects against nosocomial infection and reduces incidences of severe illness. Because already the mother is prepared, she is free from illnesses, and she is having healthy diet, and she is also immunized, and so that the baby also can be protected from any kind of disease, and there is no cross infection or nosocomial infection to the baby, right? So it reduces the chances of or the incidences of severe illness in babies. Then it facilitates better mother-infant bondage. So this is another component, the major component of KMC, because skin to skin contact always feels that the baby feels that she is always with the mother, and having eye to eye contact with the mother, it promotes the bondage between the mother and the baby. Then the mother feels increased confidence, self-esteem, and sense of fulfillment, because she gains confidence in terms of um, managing the child and handling the newborn baby if it is a primary mother, right? So she will have increased confidence level and self-esteem that she is able to manage the baby well. And the next benefit is daily weight gain is slightly better with KMC. So this is another important point, because the baby is having continuous feeding or on-demand feeding, so there is no problem in getting the feeding. So it helps to have the normal weight gain, everyday weight gain you can observe while recording the weight of the baby. And finally, LBW babies receiving KMC could be discharged earlier. So this is another major advantage or benefit to the baby as well as to the family, that when the baby is under KMC, the days of hospitalization is reduced. So earlier, in the number of days will be reduced, so that the baby can be discharged from the hospital well in advance. So collectively, these all are the benefits of kangaroo mother care. And we have some don'ts of KMC also. We should not do some of the things. Those activities are do not bath till infant weighs 2500 gram, but sponging may be done. Secondly, do not handle infant too frequently because it causes some illnesses or infections from the care providers to the newborn. Then do not give bottle filled. Only the baby should be given exclusive breast milk only, or exclusive breastfeeding should be continued till 6 months. They do not allow infant to be in contact with the sick people. So we should keep away the sick persons and they should not be allowed to handle the baby. So now when to discontinue this procedure or when they can be discharged from the hospital? One is stable and not and parental medication. When the baby is stable and the baby is not on parental medication, then very well the baby can be discharged. Or maintaining temperature in mother's bed for 3 consecutive days at room temperature. So thermal control is well achieved. In that case, the baby can be discharged. Then gaining 15 to 20 grams per day for at least 3 consecutive days. So weight monitoring, if it is proved, if it is there, the weight gain is there, then they are eligible to get discharged. Then accepting feeds directly from breast, preferably or by spoon, palade or cup, then that is also an indication that they can be discharged and the KMC can be discontinued. But usually the infant's weight is around 1500 to 1600 grams at the time of discharge. If it is there, then it is fine. And KMC should be continued as long as required, and baby and mother should not be discharged in a hurry. So it is not mandated that we have to voluntarily discharge them or by force they are going out of the hospital. No, if they are going to home also, this can be continued, especially if the weight is between 1500 or 1600 grams, but it is required still the mother can continue this KMC until unless it reaches 2.5 kg. Finally, various support methods to KMC. So as I mentioned earlier, not only the mother, anybody in the family can give this KMC, right? So the duration can be extended or it can be a continuous process. Alternatively, the family members can carry the baby and this can be continued for better and effective KMC, and due to this the baby weight gain also will be faster and the baby can reach the optimal weight gain, that is up to 2.5 kg. Very soon the baby can reach. So it is the responsibility of all the family members and awareness to be generated among the family members. As I said, counseling is more important. They should know the importance and the significance of providing KMC. Okay, if all the family members are supporting the mother, definitely the mother and the baby can come out of the health issues, especially in the baby is a preterm baby and LBW baby, right? So this is all about Kangaroo mother care. Thank you.